First of all, think about it. A person's been overweight, grossly overweight usually, quite obese. When they've been overweight for this long period of time, the problem is not with just the quick fix. It's about having the knowledge to be able to sustain weight loss once it is derived. It can be gotten there through surgical means, through lap band, through physician medications, and so on. But without the knowledge, there will be no actual value judgment within the individual. Surgical weight loss should be actually called cranial bypass, and lap band should be called lip band, and liposuction should be called hipposuction, because these things are not a joke. I actually mean what I'm saying with this. When you do surgical weight loss and you actually alter your body, when they reconnect the intestine to a different part of the digestive tract, many of the areas where certain nutrients are absorbed into the body are bypassed, and the order is changed. Many of the people 4 to 5 years later after surgical bypass have actually had many B1 deficiency problems and memory problems because of this malabsorption of certain nutrients. When you talk about lap band, imagine this. What has it done? It's forced you to stop it. It literally should be lip band. You would be better off to put the band around your head and around your mouth and just getting you to stop eating. And when you talk about other types of weight loss, such as liposuction, you're talking about stripping these cells off the body in an irregular balance. When the body starts to lose fat, there's a very unique phenomenon called reapportionment. When you lose fat on the body, you lose it from the top of the head and the bottoms of the feet toward the middle, from the ends of the arms toward the middle. Why? Because the torso needs to be kept warm, and that warmth is essential to life. And so after 11 to 13 weeks, the body starts to reapportion this fat loss if it has been sustained, properly balanced. Okay, once this is done, the body will then reapportion this fat on the torso out onto the limbs, and the overall appearance of weight loss becomes much greater. So that's called reapportionment. Most weight loss programs can't explain or don't even know this. Our clients, through actually measuring themselves every 3 weeks with physical measurements and taking their pictures, prove this to be right. When you go to a doctor and he wants to use a drug to stimulate your body, again, you're being forced. You're not being learned about anything. What you need is not just knowledge. You need working knowledge. And until these people that are severely overweight start to learn to know what is exactly causing these problems, there can be no association put with it. So they're left with an irreversible condition many times, a detrimental condition, and left worse than they were at the beginning. And here's the other problem. It's their loved ones also who suffer watching this and seeing this. It's absolute stupidity when a doctor takes an oath that says he will do no harm, he will give nutritional counseling, and he will treat for free. Go check the old oath. The new oath, as of 1964, talks about they can even take life. Now, all of this talks about they should do no harm. So where is the doctor in that he's supposed to be able to prevent things and treat you and care for you? No. What he's doing, he's caring about his wallet. The exorbitant prices that these things bring, the non-teaching that you get from them, or the so-called type of teaching that they give you is so minimal that we have seen too many wrecks from this. In fact, it's 95% wrecks. We see almost no one that comes through these things unscathed. So these things are irreversible many times. The problem still exists. It's in the mind of the individual. Until you come to what we call a mindset change, until there becomes a value judgment within you and an understanding of why and why not these things happen, you're going to keep doing these things over and over again. So when we talk about weight loss surgery, when we talk about physician help surgery, are they also guaranteeing you through an accurate body composition test such as near-infrared light, or are they using water weighing to prove that you're only losing fat? No, because you're going to be losing all kinds of other things like lean tissue. This means organs start to malfunction, tests start to go off. They've got to do all these tests they normally didn't have to do. You're becoming a bankroll for that doctor's new Mercedes. Don't be a fool. These guys have actually, these physicians have taken an oath that they are going 100% against all odds of helping you. They're being mercenary, they're not being caring, and you need to look at this. So the only thing I can tell you is you go out there and you get that information. It's available. We've helped people to lose 200 and 300 pounds. They keep it off 8 and 9 years, and you're entitled to keep your health and keep yourself secure. But if you go out there, you're just a lamb for the slaughter. Beware. Be careful. Take this into your own hands. Remember, it's your life and it's your weight loss.